Hi everyone, we're so excited you're here and joining us for our webinar hosted by Healthy Schools Campaign. This webinar is called the Healthy CPS Survey, and we're excited you could join us. My name is Rosa Richter, and I'm the moderator for this webinar. I'm the director of our Chicago programs at Healthy Schools Campaign. And in a second, I'll tell you a little bit more about Healthy Schools Campaign, but first I wanted to quickly review the logistics for today's webinar and kind of give you the run of show. So what to expect. The webinar will run approximately for about an hour. We are recording this webinar and it'll be available to view after today. We'll email a link to the recording, and it'll also be archived on our website by the end of this week. And also at the end of the webinar, if you could take a minute to complete a quick survey about your experience, we would greatly appreciate it. In addition, we'll hold the final 10 minutes for a question and answer session. And so just as any thoughts or questions come up, feel free to use the chat function that is part of your screen. So you can type in a question into the chat function, and we can read them throughout and make sure our presenters hear them, or we can address them towards the end of the webinar. So we have a great lineup today. I'll be talking a little bit just about the framing of who we are and what we work on, and then I'll hand it over to Elizabeth Hansen, who's with the Office of Student Health and Wellness at Chicago Public Schools. And then after that, we'll hand it over to our very own Kenneth Farner, our Community Engagement Manager at Healthy Schools Campaign. So with that, let me just share a little bit about Healthy Schools Campaign. We're a nonprofit organization, and our mission is to ensure every child can attend school healthy and ready to learn. And we engage parents, teachers, principals, school nurses, students, policymakers, and a variety of partners in creating healthy school environments. And by having this on-the-ground experience, we advocate for policies that support school health, and we work to build a school's capacity to put these policies and strategies in practice. We're very active at the local, state, and national levels, but our organization has a special focus on Chicago and the health issues that affect students in low-income communities. Especially in light of the vast health disparities, we strive to make equity part of the public dialogue about education and health. And again, our work is grounded in the belief that every child deserves to learn and thrive. Often we like to frame our webinars just really emphasizing that healthy students are better learners, and that research consistently shows that higher levels of achievement are often or closely related to health, and that health problems are closely connected to a hindered performance in school. We often look to a 2010 report titled "Healthier Students Are Better Learners, a Missing Link in School Reforms to Close the Achievement Gap." And this is from a professor called Charles Bosch, who comes from Columbia University, and really documents which relevant health disparities play a big part in affecting the educational opportunities and outcomes of students, especially students of color. So it boils down to the fact that student success in school is more than just academics, and evidence indicates that education and health for students must go hand in hand in order for them to succeed. So we'll pause there. We can have a whole series of webinars on this, but wanted to share this body of research, and there's a link at the bottom that you can check it out for yourself. And on our next slide, I included a few resources for you to take a look at. We know this is a critical time in the CPS timeline. Many of you are in the midst of creating your school improvement plans for the CIWP. So we have a toolkit for schools on how to integrate student wellness into that process. We also have a toolkit about addressing the health-related causes of chronic absenteeism, and then a whole bunch of resources related to how to integrate movement or physical activity healthy eating, nutrition education into the everyday school environment. So I'll pause there, and before I introduce our next speaker, Liza Hansen, she also goes by Elizabeth, let me launch a poll for our attendees. And so while I introduce her, I'm going to have you fill out this poll. And the poll is, let me find it, is what is your role at the school? So take a minute to fill that out. And then joining us from the Office of Student Health and Wellness is Liza Hansen, and she's a Healthy CPS specialist. And she is part of the health information team, and she loves crunching numbers and using Excel. She's originally from Wisconsin, and she received her MPH in epidemiology from UIC, and she is really excited to be assisting the Office of Student Health and Wellness and finding data-driven solutions to improve health and wellness in CPS. So thanks so much, Liza. Let me share the results before I hand it over to you. I'll give a few more seconds for people to fill it out. All right, so looks like let me share the poll. Now, about half of you are teachers, and then after that, it's school administrators, and then we have some partners and some teachers that are also wellness champions in the audience. Great, thanks so much. All right, so let me hide this poll, and I'm going to hand it over to you, Liza. Thanks so much for joining us today.
Hello, everyone. Thank you, Rosa, and thank you all for listening in today. So I'm just going to go into the Office of Student Health and Wellness just generally, and also talk about the Healthy CPS indicator, which will segue into the survey, and then Kenneth will go more into detail on the survey. So starting off with our mission and vision of the Office of Student Health and Wellness, which is located in Central Office, downtown. The Office of Student Health and Wellness, or OSHW, aims to eliminate health-related barriers to learning and to advance child health equity in Chicago. And we also hope that every child will have a medical home. This is one of our goals. So going into our organizational chart, just so everyone knows which department corresponds to which underneath the Office of Student Health and Wellness, we have health promotion, health information, student health services, and child and family benefits. Health promotion is more of the programming related to actual health promotion. So we have the sexual health education, physical education, school food, school gardens, chronic conditions. Health information is where I fall, so that's under the evaluation, communications, technical assistance, and surveys, such as the Healthy CPS Survey. And then we have our vision and hearing screenings on health services, and then the Children and Family Benefits Unit focuses on Medicaid and SNAP enrollment. So the Healthy CPS indicator was made so that schools can meet existing requirements. So it's a way that we're able to understand better what is going on in schools and just help you achieve what is already laid out in policy, but just to make it a little bit easier, including building some tools to help you achieve and implement those policies. All right, going into the badges. So you'll see that there's 4 badges here on the Healthy CPS indicator: chronic disease, instruction, learn well, and health services. So we'll start with the chronic disease badge, where students should be supported who have chronic diseases such as asthma, food allergies, or diabetes. So the ways in which they can be supported is by schools identifying them in the first place, knowing that they have these conditions, and understanding what to look for, which can be achieved by training all staff through our chronic conditions webinar. And so the webinar is available on the Learning Hub and was hosted by our Chief Health Officer, Dr. Fox, and we also hold chronic conditions related trainings at our mid-year and back-to-school PDs. So moving on to the instruction badge. This is really focused on curriculum and training for nutrition education, physical education, and sexual health education. The Learn Well badge is focused on wellness, so it's the wellness portion of the Office of Student Health and Wellness. So this gets into healthy foods and physical activities such as recess, nutrition standards, incorporating physical activity into the classroom and into the school environment, safe and supportive environments, so creating a supportive environment for the LGBTQ community, and school gardens promoting healthy eating and positive relationship with food through school garden development, and then also promoting healthy relationship with food by healthy fundraisers and rewards and celebrations, and understanding best how to reward our students and celebrate what needs to be celebrated while still being healthy at the same time. So then our health services badge is focused on school participation in our district-wide programs for dental exams, vision and hearing screenings, and immunizations and physical exams. So some of the tools that we've developed as an office as part of the Healthy CPS indicator to achieve Healthy CPS is our checklist. So this is interactive and it's available on the Knowledge Center, but I just did an excerpt here of which falls under the instruction badge. So as you can see, when you click on it, it'll have an action step to respond to whatever you click that's relevant to your own school. And then if you haven't met that criteria yet within that category, then it'll give you some steps to try and help achieve that within your school. Another tool that we use for Healthy CPS implementation at the school level, besides the checklist, is the action plan, which actually goes kind of hand in hand with the checklist. The action plan comes right after the checklist. So after you've kind of assessed what you already have under control and what you need to work on, then it's getting more specifically so you can develop your own plan and assign leads to accomplish those goals throughout the school year. So going into Healthy CPS data, this is an excerpt of the Healthy CPS Report, which all of you should have received last year, and which is actually available online for all of you, which I'll show you how to access momentarily. But as you can see, there are 3 pages long. The front page has the school name on it, and then just shows your own Healthy CPS indicator for your school, which if all of those badges are lit up or they're filled in, that means that you've achieved all of them. Whereas if there's anything less than 100% for any of the badges, those won't be lit up. And then it goes into the specific criteria under each badge, just listing out the specific requirement and whether or not it was achieved for your school that school year. So the scoring system, just as a reminder, if not all criteria are achieved within each badge, then the badge will not be considered achieved entirely, so therefore it won't light up. And similarly, if all 4 badges are not achieved, so if not all 100% of them are achieved, then you won't be achieving Healthy CPS, as we say. But if they are, then your school will have achieved Healthy CPS. All right, so finding your Healthy CPS report, put the link here. It should be clickable, but if not, it'll be hopefully there long enough to copy and paste into your browser. But in any case, it's just on your school profile page online. So if you find your own school, go into downloads and then go to the other column, and then the report name is Healthy CPS Report. So it should be downloadable for everyone. And then if you also go back to the reports tab, which is to the left of the downloads tab, then you'll see that the indicator only will be there as part of your school progress report. So that won't show like the criteria specific or badge specific details the way the report does. It'll just show basically your % achievement for the overall Healthy CPS indicator. So going into Healthy CPS data sources, which will result in the Healthy CPS report and your achievement status, is the Healthy CPS Survey, which will be going out soon, Impact SIM, the Student Information System, Learning Hub is where we get a lot of our training data, and then Aramark is where we get some of our information on breakfast after the bell and school food. So specifically the Healthy CPS Survey, I just wanted to share a timeline with you so you know, since it's a little different than last year. So the survey will be released on Monday, this coming Monday, which is the 16th of April. We're giving just shy of a month to complete that. So the final deadline for that is May 11th. However, if you complete it early by May 1st, then you'll be entered into a raffle for $500 for your school, of which there are 20 prizes. The Learning Hub data, as I spoke of earlier, where we get a lot of the training data for chronic disease, sex ed, and SSE trainings, that will be pulled on June 19th. So you have until then to complete all those online or in-person trainings that will be recorded on Learning Hub, because after that, basically the same time school ends is when we're going to cut that off and then just perform the analysis based on whatever happened up until that point. The exemplary nominations, that's a chance for your school to nominate someone, either administrator or a wellness team or wellness champion that has performed exceptionally at attempting to achieve healthy CPS and creating a safe and supportive and healthy environment in your school. So the nominations are released mid-April, and then the deadline for that will be the end of June. After that, we're going to be releasing Healthy CPS reports much earlier than last year. So it'll be the first day of the Principal Institute, which will be July 9th. And then if there are any issues or corrections that need to be discussed in the report, we're giving 2 weeks for that. So the final cutoff for that is July 26th, and then we'll be releasing the final reports in August. And then after that, the reports will be made available once again on the school profile pages online whenever the SQRP reports are going to be finalized, which should be around October. So that's all I have. If you need to contact me, my information is on the left side. And then my colleague, Sarita, is a Healthy CPS specialist as well. You may have interacted with her before, and her contact info is there as well, in addition to our general office's info below.
Thanks so much, Liza, for that informative presentation. I think it's really nice that you brought us through the process of how to work towards achieving that, but also being so detailed in the timeline of once they fill out the survey, what happened. So thank you. Before I introduce our next speaker, I'm going to launch another poll. We are curious to see how many of you have actually filled out the annual Healthy CPS survey before. So take a minute to take this poll. And in the meantime, let me introduce you to Kenneth Varner, who's our Community Engagement Coordinator for Healthy Schools Campaign. And in his position, he gets to work with parents, teachers, students, and school administrators and many community members in adopting health-promoting practices and policies that enhance student health and wellness. So he has lots of great experience on the ground working with schools and navigating all these, at times complicating systems. So let me share with you our results. Close this poll and then share. So it looks like, a good majority of you have filled it out, but also a few newbies that we got in the group. So I'm sure this information is really helpful for that. So Kenneth, take it away.
All right, thank you, Rosa, and thank you, Liza, for that great presentation. Hello, everyone. Again, my name is Kenneth Varner. I'm the Community Engagement Coordinator with Healthy Schools Campaign. And as Rosa just explained, I have been gone through this process a while with schools, helping them to create healthy environments. This will be my second year with helping schools prepare for the survey. But before I was in this position, I was also working at a school in Chicago, at an elementary school, where I was serving as a wellness champion for about 3 years. So I definitely have the experience of being on both sides of it. So hopefully I can have some best practices to share with you. All right, so what I'm going to go through today, we're going to start with what you should do to prepare for the survey. There are a few documents that are requested by CPS that you have to upload when completing the survey. I'm going to go over that. I'm going to highlight some key individuals that you should speak to because this is not something that you should try to accomplish alone. Go into what you should actually do when completing the survey, go through a few best practices, and then reiterate what those deadlines are and go into depth about that. So, in preparing for the survey, you should enlist one person to complete the survey. This is very important. We've had times in the past where you had different people answering different things, and if you don't have one person to corral all the information, sometimes things get lost in translation. So I see there's some wellness champions here, there's some administrators here. Wellness champions, this is probably going to fall onto you as just being the corraller of the information. That doesn't mean you have to answer every question by yourself. That just means you're going to be the person that funnels all the information into the survey. Administrators, if you're not going to be the one completing the survey, please select someone that is willing to take on this role. And before starting on the survey, I highly recommend that you review the checklist that Liza had pointed out. Even if you've selected yes on some of those items, there are still follow-up action items that go along with that. So you want to make sure you read through that. You can see where your school is. That can give you a good idea of where you stand and what's the outcome of the Healthy CPS survey is going to be. Also review the action plan, because there are going to be some things that you selected that you had planned to do this year. You just want to make sure that you dotted your I's and crossed your T's. You don't want to miss getting a badge because you didn't fill out something, like you didn't put in the designated care aid, the delegated care aid person into impact. So you just want to make sure that you've done everything that you need to do, and those action steps on the checklist and the action plan will help you do that. I highly recommend printing a copy of the survey. There's a couple of reasons that you should be able to do that. This will allow you to speak to different individuals and jot down their responses. This will also give you the opportunity to delegate some things. You can, for example, if you have questions about PE, you can give that PE teacher a copy of the paper where they can fill out the information, and give another copy of the paper to the nurse where she can fill out her information, so that people can be working on the survey simultaneously, and then you collect it back from them, as opposed to having to go around the school and speak to everyone individually. So that, in my opinion, is kind of the best way to go about it. And then you also want to gather all the required documents, what I'm going to go into shortly. You want to upload those onto the device that you're going to be working on, i.e. a laptop. And so that way, when you're sitting down and filling out the survey online, you have all that information readily available where you can just plug it in as you go, so you don't have to start and stop. I would also recommend saving it into a Google Doc, so that if there are any issues where something goes wrong and you want to like change an answer or something like that, or you have to send that documentation back to CPS, you can be able to access that from anywhere. You don't want it to be in the building at your school and you're not able to access that laptop. So you just want to have that on a Google Drive. I'd recommend that. Going into the documentation that is needed, the first one is going to be the nutrition education lesson plan. That is going to be something that you actually use during the school year. So not just like something generic that you print online because you're filling out the survey, and not your favorite cat meme. These are going to be things that CPS is going to be looking at. So please upload something that you have actually done during the school year. The second thing that we're asking you to upload is a student medical information form. That would have been sent out at the beginning of the school year. And CPS is asking that you upload a redacted copy of the student medical information form. And this is what that's going to look like. On the left, you're going to see the student medical information form as completely filled out. But this is one I made up, obviously, because we do not want to be sharing of people's personal information. So on the left, let's say you sent this out to Miss Jane Doe. She fills it out for her son, John. She sends it back to the school. You want to get a copy of this paper from the main office or the nurse's office, wherever this is kept. Make a copy of it, give the original back to the person so they can put it back where it belongs. You can take a Sharpie and cross out all the information that personally identifies that student. So the student name, their date of birth, their ID, Medicaid number, the parent's information as well. What you really want to have there is the fact that this is from this current school year, the 2017-2018 school year, the school, and the date. The grade will be fine because there should be plenty of people in a particular grade, so this will not be able to identify a particular student. And then the next thing you would want to upload is the sex ed notification letter. So if you are teaching sex ed at your school, there should have been a few notifications to the parents letting them know that you're going to be doing sex ed, one of which is going to be a opt-out letter. So that would be simply stating that you are going to be teaching sex ed, and if that parent or guardian does not want their child to participate, this is the time to let you, the school, know. So that should just be the actual one that you sent home, a copy of that, so on your school's letterhead with the date. So going back to who you should talk to when going around and doing the survey, you want to make sure you're asking the right people the right questions. So if you have questions about medical info, you should definitely be talking to the school nurse or the case manager. You have questions about how much physical education students are getting, that is a question for the PE teacher. Sex ed, nutrition minutes, you want to speak to the health teacher. Even when you deal with things about like whether healthy foods are promoted in the cafeteria, that is something that you want to deal with the lunchroom manager about, the lunchroom staff. The notifications that went home, you want to deal with the main office staff. Also, make sure you speak to the wellness team if you have a wellness team at your school, because there's going to be a lot of health initiatives that are going on that you may not necessarily be aware of. So you just want to make sure that you speak to everyone that is possibly doing anything, because you don't want to say that you aren't doing something and not getting credit, and then come to find out later on that your school has implemented these initiatives and you were just not aware. And also speak to the administration. I would recommend before submitting the survey, you speak to the administration, because that's kind of going to be your catch-all. The administration is going to know everything that's going on in your school before and after school. There are some things that are health initiatives that will be taking place after school when some teachers may have left the building that will speak to something that is on this survey. So you want to make sure that you're getting credit for everything that you are doing. All right, and when completing the survey, again, you should review the information with the administration. So the link should be sent to the administrators, and you'll be able to go online to complete the survey. But before you go and start completing the survey, speak to the administration just to make sure that everyone is on the same page. There's been times in the past where a wellness champion has submitted something, but the administration didn't look over it first, and then there's like, oh wait, we definitely do that, but the wellness champion wasn't aware. So you want to make sure that everyone is on the same page before submitting the survey, because once you hit submit, you cannot reopen it. Again, upload the required documents to the device that you're going to be using or the Google Drive, just so you can have that on hand when you're completing the survey. Then, of course, you're just going to be completing the survey online. CPS will not be accepting mail-in copies or anything like that. It's all digital. All right. A few reasons schools have missed the mark in the past, in my experience. Again, sometimes things aren't filled out correctly, or you ask the wrong person for the wrong information. An extreme example, if you're interested in how much physical activity a kid is getting in gym, you don't want to ask the lunchroom manager. That is an extreme example, but you just want to make sure you're asking the right people the right questions. Sometimes you can be unaware of specific requirements. In those situations, for example, if you have a delegated care aide, that person also has to be put into the impact system. So you want to make sure like all the little intricacies that you need in order to get credit are done properly. Another example of not understanding the specific requirements, a school may be offering 120 minutes of gym class for a student every week, and you may think you're falling short of the 150-minute requirement. However, 60 minutes of health education is also factored into that. So you can do a minimum of 90 minutes of like PE taught by a PE teacher, and then that's 60 minutes of health education, which can include nutrition education and sex ed. So you just want to make sure that you're aware of all the requirements when you're filling things out. So you don't want to say you're not doing something when in actuality you are. Other situations, the entire school staff may not be on board with the health and wellness initiatives. You may have that one teacher that definitely want to hold out John Doe for acting up in class, and to say, well, if John took up my time, I'm going to take up John's time, and they're not going to have recess. We understand that this is an ongoing issue. and we highly recommend that you brainstorm in ways to, in order to tackle that. But it is something that we have seen, and it is something that still needs to be addressed. Sometimes you have parents that are just not on board. They want to celebrate their baby, and they're going to send their cupcakes, and they're going to have those celebrations in school. Please let them know that it is a policy, and those things are not necessarily allowed. And I also want to acknowledge that sometimes things are just hard. There's not enough time in the day to complete all the things that you do for the youth in our city, and I applaud and I thank you. And I just want to say that I understand that it can be difficult in completing these things. It's a hard road, but it is worthwhile. And then sometimes you may submit things on the report, and the data just disappears. Systems have glitches. These things happen. That's why it's important to also keep a copy of all your documents that you have uploaded to the survey. Make sure that you have those, the redacted forms only. You don't want to have student medical information floating out there. And also just keep track of all the other initiatives that you're doing in the school. If you're doing physical activity in your classrooms, take a picture of kids doing an example for Go Noodle, and just have that on hand. Just things that can back up your story. There's nothing wrong with just having things. CPS may not necessarily ask you for those, but I just recommend having those things, just showing what kind of school you are. All right, going back over some of the deadlines, again, May 1st, if you complete the survey by May 1st, the survey will be released on April 16th. If you have it in by May 1st, you will be entered into a raffle for a $500 prize. There's going to be 20 of those. May 11th will be the final day for the schools to submit the completed survey. And then on June 19th is going to be the last day to have all the chronic disease PDs completed by your staff. I would highly recommend not giving your teachers the June 19th deadline because you want to be able to follow up with anyone who misses it. I doubt you'll be able to contact anyone over the summer. So I would recommend having that a little bit earlier if you want to have that in May, like May 11th when this survey has to be submitted. But I would highly recommend setting that deadline beforehand. And also, I just wanted to point out, we need to keep in mind the spirit of completing these PDs. For example, if you have a student that is allergic to bee stings, we're going to be working in the gardens now. We're going to have kids being outside more. If a kid gets stung by a bee, you want to make sure that the staff that's on hand is aware of what happens when someone is allergic to a bee sting, where the EpiPens in the school are, and how to administer them. This is not just simply a box that needs to be checked off because someone's going to be asking you to complete this survey, so you need to make sure you've done this PD. This actually has real life consequences if people are not aware of the information. So let's keep that in mind when we're selecting to do these PDs as well. And with that, that concludes my presentation. And right now we have some time for some questions.
Great. Thanks so much, Kenneth, for that informative and on-the-ground experience that you shared with us. Liza, we actually have a few basic questions that came in. How long is the survey?
It's not numbered right now, but it's about 40 questions.
Okay. And then someone else said, when doing the survey online, when filling it out, do they have to complete it in one sitting?
No, I actually wanted to bring that up too. In addition to that, just how the survey is actually going out, because I didn't specify that before for the April 16th date. So as far as the logistics of completing it online, when you click the link that will be shared with you, it'll take you to the survey platform where you're going to log in with your school ID. And at that point, you're going to be starting the survey for just a one-time experience, meaning that once you submit it, you won't be able to click that link again and resubmit or change your answers. However, if you don't click submit and you just leave it partially completed, then you will be able to close out of your browser. You don't have to save and quit or log out or save or anything like that. Just, click on the link, start it, get as far as you can. You can navigate in between pages where the questions are, but once you click submit, that's it. So basically, if you want to complete it in phases, then just close out of your browser whenever you're done for the day, and it'll save that information. And then the next time you want to open it back up again to add more information or edit anything from before, then it'll just, you'll just have to log back in with your school ID again, and then it'll take you back to the most recent page you filled out, but you'll also be able to go back to the previous pages as well.
That's great. That's like super convenient. Someone has a really specific question. They're asking if we reward a class that has perfect attendance with a movie and they serve snacks during the movie, is that considered food as a reward?
So the survey asks the question this year as far as celebration goes in terms of school-wide versus classroom-specific celebrations. So we're trying to communicate better about the policy on celebrations, which states that classroom or unhealthy celebrations, if anything, should be school-wide. So anything specific to a classroom would not be acceptable if it's related to food. If they're serving food. And then, sorry, for the, as far as the survey being communicated out, I just wanted to be more specific about that. So the survey is going to be released via this principal newsletter. So it's going to be, which will go out either tomorrow or Monday, but definitely by Monday. So the principals obviously have direct access to that. And then it'll also go out in our Healthy CPS Digest to the Health and Wellness Champions. So they'll receive that through that method.
Great.
And can I also put something else out that I thought of? So as far as the Learning Hub data goes, for the June 19th deadline, I just wanted to make everyone aware, if they're not already, that principals are able to look up their own school status or progress as far as certain trainings. So they are able to access a list through Learning Hub that shows how many staff members in their school have completed a certain training. So I just wanted to let you know, so you'll be, like, the administrators can look it up themselves if they want to, so.
Is it pretty, like, self-explanatory how they do that, or do they need to visit the Office of Student Health and Wellness page, or?
Yeah, I believe it's a PDF that has instructions to do it, so it's not as complicated as 1, 2, 3. It's more like 1, 2, 3 through 10, but it is available on the Knowledge Center, but you can also just email oshw@cps.edu, and then we'll send that PDF right back to you with the instructions on finding out your own school's progress on completing those Learning Hub trainings.
Great, thank you, Liza. Is there anything else you want to add, Chip? Okay, so I think what this attendee is asking is, if in terms of the specific question of they're hosting a movie to celebrate, they feel like it's kind of in the gray area, like is it okay for them to serve snacks during a movie, or is it going to be considered food as a reward, even though the big focus is the movie as a reward? Yeah,
I think I understand how that could be kind of complicated, but yeah, that would fall under food as a reward since it's associated with a specific group of students doing something and getting recognized for it. So.
Okay, thank you. And then lastly is, what happens if the school and CPS disagree with the results? What is you kind of alluded to the process.
Yeah, so if you recall last year, we had a period of time after the survey analysis was complete, before the reports came out, where we reached out to the schools where there was missing data or confusing answers on the text entry portion of the survey. So that's kind of all being consolidated with the report feedback portion that happened last year. So basically, in the second 2 weeks of July, right after the reports are released on the Principal Institute Day, that'll be the time where if you see your report and something seems wrong, either based on the way you filled out the survey or anything else you're aware of going on in your school, that's your opportunity to reach out to us. Our office is going to be present both days at the Principal Institute, so you can come to our table and talk to us in person, or of course you can reach out to us by calling us or emailing us about your reports. So that's going to be your opportunity in case there's any errors that need to be corrected before the finalization of the reports happens by August.
Great. Thank you, Liza. Thank you, Kenneth, also for presenting. We also just wanted to share a list of partners that can help your school in filling out the survey or helping you, for the process next year of how to achieve the Healthy CPS badges. And so this is a list of organizations that can help you provide physical activity or nutrition education or just overall school health and wellness initiatives, and can really help you fulfill the requirements of the district's health and wellness policies. And this is a group that's been vetted by CPS pretty thoroughly. So with that, we just want to, again, share some resources, and we'll send the slides out probably tomorrow or the next day, and also a link to the recording to this webinar. And then lastly, here's our contact information. If you think of any questions after the fact, feel free to email us, and we'd be happy to help you out. So with that, thank you so much. We know you're all very busy, and we really appreciate the time that you've taken to be with us. Thank you.
Thanks.